Hey guys, Oscar here with Gastroenterology Simplified. I'm a board-certified physician assistant, and today we are going to be talking about Acanthosis Nigricans. Before we go any further, I want you to understand that this video is for educational purposes only. If you have any symptoms, concerns, or any questions, always consult with your primary care physician or your physician assistant. Now, before we talk about Acanthosis Nigricans, I want to go ahead and set up the picture here for you, or the situation that gave me the thought of actually investigating more and creating this video for you guys. My cousin is about 39 years old. For the past 3 years, he has had a work from home situation. His lifestyle is very sedentary. His diet is not the best. And he has put on some weight within the past 3 years. Now, he calls me and he tells me that he has developed this dark rash on the back of his neck. And he feels like it is dirt, but he has been scrubbing and the dirt does not seem to go away. So he sends me a picture and I look at the picture. I go ahead and ask more questions, and this is consistent with Acanthosis Nigricans. I did ask, have you seen your primary care physician or your physician assistant recently? And he said yes. He tells me that his hemoglobin A1C is a little bit elevated, not in the diabetic stages, but pre-diabetes. His lipid profile is elevated, so his triglycerides, cholesterol, are elevated, and once again, he has put on some weight. His BMI has increased. After reviewing the records and taking a look at the pictures, this is consistent with Acanthosis Nigricans. Now, what is Acanthosis Nigricans? Acanthosis Nigricans is a skin condition where the areas of the skin become dark, thick, and velvety. You may ask, how does it look like? Well, it looks darkened, brown, or black, patches, thick, soft, velvety in texture. The common areas affected are the neck, which is the most common, armpits, groin, elbows, knees, and knuckles. What actually causes Acanthosis Nigricans? The most common cause is insulin resistance, where your body isn't responding well to insulin. Other causes may include type 2 diabetes, obesity, hormonal disorders such as PCOS, certain medications such as steroids, estrogen, or nicotinic acid. Rarely underlying cancer, especially GI cancer or stomach cancers. Now, let's go back to what are the causes of Acanthosis Nigricans. Let's go back to the case of my cousin. So, he has had a very sedentary lifestyle for the past 3 years. Poor diet, he has put on some weight, and his diet, once again, is not the best. He hardly gets any more than 3,000 steps per day. His blood workup shows that he is pre-diabetic. His lipid profile is a little bit elevated, and he has a condition that we could describe as metabolic syndrome. Once again, he is not diabetic yet, but he is pre-diabetic. Now, when should you worry? You should worry if the rash or the changes in your skin appears suddenly, if it is spreading quickly, or if you're not on any risk for being a diabetic, you're not pre-diabetic, you're not overweight, you have a very active lifestyle, and you're not taking any medications that could be changing your skin. For example, steroids, nicotinic acid, and other medications. If the rash suddenly appears and if it is spreading quite quickly, this could be a signal of a more serious underlying condition. Can Acanthosis nigricans be treated? The answer is yes, it can be treated. When you focus on the underlying cause, for example, losing weight, lifestyle modifications, healthy diet, and doing some strength training, then the rash suddenly starts improving, the rash disappears, and issues go back to normal. Improving insulin sensitivity, once again with strength training, losing weight, and having an active lifestyle, usually it fixes the rash or the situation. Treating hormonal issues helps as well. And lastly, the skin appearance often improves once the cause is addressed. In conclusion, Acanthosis nigricans could be a condition or a signal that your body is giving you that your body is not processing or is not sensitive to insulin. And we need the insulin to digest foods, break down sugar, and so on. So your body is giving you a signal that, hey, you need to do something here. You need to have a change because the body is suffering. And this is a signal that your body is giving you. If you found this video helpful and educational, then don't forget to follow Gastroenterology Simplified for simple and clear medical education. Once again, this information right here is 100% free. Free to you. All right, I'll see you in the next one. Bye.